Hi, my name is Anthony Tran. I'm a fourth-year medical student at the University of Massachusetts Medical School. In this video, I would like to demonstrate the proper techniques on how to use an ophthalmoscope and how to perform a fundoscopic exam. This portion of the physical exam is often very daunting and not easily navigated for a first-year medical student. So hopefully this video will clarify some things, and I would like to offer some tips and tricks on how to perform the exam as well. And like any part of the exam, practice makes perfect, so keep practicing. So there are many shapes, colors, and sizes for the light beam to project onto the patient. What I recommend is finding the largest circle, which is this one, and it's in the white color, which will give you the best visualization. It's a common misconception that the brighter the light, the better the visualization. What I recommend is actually dimming the light, which not only allows patient comfort, but also allowing the pupils to dilate for a better look inside the back of the eye. To start the exam, I would recommend putting your lens disc at the 0 diopters. For nearsighted patients, you can adjust counterclockwise to the negative numbers. For far-sighted patients, you can adjust clockwise to the positive numbers. So getting the technique in proper order, what you want to do is, if you're examining the patient's right eye, you want the ophthalmoscope in your right hand and using your right eye to examine the patient's eye. It goes in the order of right, 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 and vice versa if you're examining the left side. To preface the exam, you wouldn't tell the patient that you will be putting your hand on either their forehead or their shoulder to gauge distance as you do the exam. Now putting it all together, here's how the exam would look. Kieran, would you please look straight ahead at a point on the wall?
Sure.
Just gonna put my hand on your forehead just to make sure I'm not getting too close, okay?
Mm-hmm.
Right now I'm just taking a look at the back of your eye. Everything looks fine and in order. How's the light right now for you?
It's perfect.
First, standing at a distance, you should look for the red reflex. The lack of a reflex can indicate etiologies such as cataracts or an artificial eye. Find the optic disc, which appears as a round yellowish structure at the center of the fundi. If you have trouble locating it, find a vessel and follow it towards the center of the eye, leading you to the disc. Note the color and sharpness of the disc outline, assessing for papilledema. The size of the physiologic cup, which enlarged can suggest chronic open-angle glaucoma. Look for blood vessels. Veins are darker and tend to be larger than arteries. Follow them peripherally. Examine the retinal background itself for hemorrhages, cotton wool patches, and changes in pigmentation.